feel that this is our time. Cancer will be the one that we're going to find advances to keep the patients alive and also maintain their quality of life. And I wanted to be part of this. I just was fascinated by how the care is becoming so personalized. We're switching to targeted therapy, immune therapy. We're not just giving chemo. And that's why I decided this is what I want to do. I want to be part of improving cancer care. 50 years from now, when people say, oh, cancer, now we can't treat it, I want to be one of those people who contributed with a break maybe, or help in the foundation of building a way to treat cancer or maybe even cure cancer. It is fascinating. I mean, I do research now in our practice, and every time I do training for a new drug or to go to a meeting, the new things that are coming are really amazing. So that's what I love about oncology. I mean, people say it's depressing, but I feel like, yeah, it could be depressing, but if I can be the one who can bring back the hope to the patient, that's great. People see the cup half full. I tell them, if I find 2 drops, that's good for me to work on it. The credit of patients' outcome when it's good, it's not just me, it's a teamwork. The nurses, the social workers, the financial counselors, everybody contributes. The thing is about cancer, it's again a bad diagnosis. And the simplest thing can affect the patient, even in their treatment. Patients can have a lot of side effects, but when you talk to them and smile in their face, that makes them feel better. They tolerate chemo better. So the feeling that you get from the patient telling you that I enjoy working with you, or one of the things that I hear from patients, even after meeting from the first time, they say, you know, doctor, I do feel better now. I do believe that we can help people, we can do more. And you know, that's one of the reasons I also always do support groups. I mean, even with my busy schedule, I always find time to do support groups. I don't want people to feel like, okay, now he's a big shot, he's not, you know, I want him always to feel that if you need me, I'm there. Even with my busy schedule, I'll find the time and give you the education you need. I feel that this way, I don't only educate the patient, I educate their doctors sometimes. Because I have patients who go to support group meetings or lectures, they come, they say, oh, they put this thought leader gave us a talk about such and such. Did you hear about that treatment? It's like, well, no. And then I read about it and then I learn. So indirectly, this doctor taught me something. So I feel if I teach the patients and they go back to their doctor and challenge them with questions, I'm teaching the doctors indirectly. And that's how education is spread. And I think education is knowledge, and it's also power. Knowledge is power. Because the more you know, the more you can fight your enemy. I mean, cancer is like we're at war. And I always tell patients, the more information we have about the cancer, the better we can fight it. So that's why I do it.